The senator from Essex and Middlesex, Mr. Finegold, has filed an amendment the clerk will read.
Amendment number 528 by Mr. Finegold, Medicaid and health benefits.
Senator Finegold.
Thank you, Madam President, and through you to the members. First of all, I want to thank the Senate President and Chair Rodericks for their great work on the budget this year. I'd also like to thank Chairwoman Friedman for her dedication and advocacy on health care policy. I tend not to speak often in the chamber because when I do, I hope people will listen. And this is one of those times. This morning, I spoke with the president of Lawrence General Hospital. There was a tremor in her voice. Yesterday, she had to let go 56 people at the hospital that is already short-staffed. Families in Lawrence have been through so much during the COVID-19 pandemic. The pandemic has devastated the city, and Lawrence General has been the city's last line of defense. Around 1 out of every 4 residents has tested positive for COVID. And 250 people have tragically died from this disease. Overall, the city has one of the highest caseloads and death tolls in the state. Please pay attention to this one. The death rate for Latinx residents has been significantly higher than that of white residents. That is a reality of what is meant to be a poor person of color living in Lawrence during the pandemic. And while we talk about how everyone's coming out of this, Lawrence is still in the red. It's one of only 2 communities at the highest risk category for COVID transmissions. And compared to the greater Boston area, Lawrence has far fewer hospitals and hospital beds within a 10-mile radius. In these trying times, the workers at Lawrence General Hospital have gone above and beyond to save countless lives. They provided excellent inpatient care. They've set up a testing site that has tested over 234,000 people. And they've administered more than 100,000 doses of the COVID vaccine. I shudder to think what the cost of COVID would have been for the community of Lawrence if Lawrence General was not there. And the pandemic didn't just impact healthcare, it also wreaked havoc on the local economy. Besides being in a healthcare crisis, Lawrence had the highest unemployment rate in the state. Thousands have lost their jobs, businesses have been shut down, and families are struggling to make ends meet. which is why we simply can't afford to have massive job cuts at Lawrence General Hospital. The hospital is the largest employer in the city of Lawrence, employing nearly 2,000 people in well-paying jobs. And most of these employees are Latinx. Right now, my fellow colleagues, safety net hospitals like Lawrence General Hospital need our support more than ever. And I ask the question, if we, as a legislative body of the state of Massachusetts, are not looking out for these people, who will? We need to implement long-term structural reforms to hospital reimbursement rates and provide immediate short-term funding to help Lawrence General and other community hospitals survive the impact of this pandemic. And leading up to this pandemic, Lawrence General was already facing an unfair playing field because of chronically low insurance reimbursements. First of all, Lawrence General has a much higher Medicaid payer mix than other hospitals. 30% of Lawrence General gross revenues come from Mass Health, compared to the statewide average of 18%. And why does this matter? Because Mass Health provides lower reimbursements than private insurers. So you're penalized if you have Mass Health. And oftentimes it reimburses less than the actual cost of care. So in effect, Lawrence General is being penalized for taking care of the most vulnerable people in society. And to make matters worse, in recent years, state officials have slashed Mass Health rates even further. Check this out. Back in 2018, Lawrence General received $267 for an ultrasound. Now it receives only $159. Tell me one business that can afford that type of cut. I fully understand the need to contain costs, but the state's harsh policies have crippled safety net hospitals that rely on Mass Health funding. We must create a more fair funding model. Now, if that's not bad enough, Lawrence General and other community hospitals also tend to receive substantially lower payments from commercial insurers. This disparity hurts low-income, majority-minority communities like Lawrence and is a manifestation of systemic racism in the insurance industry. This is modern-day redlining. If these discriminatory practices occurred in the banking industry, these companies would face severe penalties. So I ask the question, how can we tolerate such overt inequality and racism in the insurance industry? How is this fair? Because according to recent data, Lawrence General received only 79% of insurers' statewide average in relative prices for reimbursement. For example, Lawrence General receives $100 for an insurer for performing a chest x-ray. That same exact x-ray, Mass General gets $180 for that x-ray. Is someone in Boston twice as important than someone in Lawrence? How about this one? Lawrence General gets $260 performing a mammography, and Nantucket gets over $700 for that same procedure. Now let me ask you this question. Is someone in Nantucket worth 2.5 times more than someone in Lawrence? Where's the equity? Where's the fairness? Imagine this. Imagine if a bank gave out a loan to someone in Lawrence at 10% who had perfect credit, and then someone in Nantucket who had the same credit at 4%. That would never be allowed. So why do we allow all these inequities to persist in the insurance industry? And this is just not Lawrence's problem. Places like the Holyoke Medical Center, Brockton Hospital, Hayward Hospital in Gardner, they're in the same boat. Community hospitals are doing invaluable work to improve health outcomes in lower socioeconomic communities. But insurance companies refuse to pay these hospitals what they deserve. And that's why I have put forward Amendment 528, which will require commercial insurers to reimburse community hospitals at 100% of the insurer's statewide average relative price. And because of this long simmering inequities, Lawrence General was already struggling prior to COVID. The pandemic has poured gasoline on this fire and greatly exacerbated Lawrence General's financial troubles. When COVID cases skyrocketed in Lawrence, Lawrence General had to cancel elective surgery sooner than most hospitals, at the cost of millions of dollars. Lawrence General also had to dramatically scale up expenses to meet the community's needs, investing heavily in COVID-related inpatient care and increasing spending on PPE. Given the city's high caseloads, many patients have been reluctant to go back into the hospital and receive the routine care they need. This has further undermined the hospital's finances. All told, Lawrence General suffered a $13 million loss in 2020, despite receiving federal aid in the CARES Act and state aid through supplemental mass health funding. That's how dire this situation is. And their financial position for 2021 looked even bleaker. Absent additional federal or state aid, Lawrence General is projecting a budget deficit of $20 million. So, you save people's lives, you help on the front line, and this is the reward that Lawrence General gets for saving lives, serving the most vulnerable people in our society.